sitting there live in a short while to listen to her. Once again, many thanks for joining us here on KTN News Desk. Let's begin this bulletin with some alarming news, and a mutant of swine flu, otherwise known as H1N1 virus, has been reported in Nanyuki. That has been confirmed by the Laikipia health official, Dr. Donald Mogoi, after receiving results from the National Health Laboratory. Let's speak to Dr. Mogoi on phone. He now joins us live by way of phone from the county of Laikipia with an update. A very good afternoon to you, sir. Thank you very much for joining us here on KTN News Desk. Just for the sake of our viewers, what is the mutant of a swine flu? What is the difference between that and swine flu itself?
Now, remember we had a swine flu outbreak in the Middle East in the year 2009. Now, from 2009, that virus has kept on mutating, and now what we have in Laikipia is a mutant that is called A1H1N1 prototype of 09. That actually is now a seasonal flu that circulates in the air, and that happens when we've got weather changes. Like now we're having a weather change from being very hot to a rainy season that is cold, and because of that, and because the virus is circulating in our atmosphere, people are most likely to acquire or get it.
So what is the situation currently in terms of the damage that this particular virus has already done?
Of course, what you're seeing is more cases of people who are coming to our hospitals with cough, high fevers, running noses, and the sore throat. And we are managing. Nanyuki Hospital alone is seeing close to 60 to 70 patients on a daily basis with such symptoms. And we are managing them. Currently, the management is actually symptomatic because this is a normal flu. We are calling it like a normal flu.
Should residents in the county of Laikipia and the rest of the country be worried? What are some of the precautionary measures they need to take?
No, they don't need to be worried. The only precaution is the residents don't need to be worried because, one, H1N1 or the subtype that you're dealing with doesn't kill unless it complicates and causes pneumonia. And if managed early, if they get to the hospital early and they're given the drugs, then we are able to control it. Two, the next thing that they need to do is to keep their hygiene, good etiquette when they're having a cough, wash their hands. If they maintain that, then definitely we'll manage it.